Good evening and welcome to the 49th Legislative District Virtual Town Hall. Tonight you'll be seeing and hearing from State Senator Annette Cleveland, State Representative Sharon Wylie, and Monica Stonier, with special guest Dr. Alan Melnick. Now I'm going to turn it over to Representative Wylie for opening remarks.
Thank you, Travis. We're really excited to be getting started. This is the first virtual town hall we've ever done. We've already received dozens of questions from constituents through our email. But if you're watching on one of our Facebook pages right now, you can leave a comment with your question. One of our staff will relay it to us. We're going to try to do what we usually do, which is try to get through all of the questions. And so we're going to get started as quickly as possible. I'm State Representative Sharon Wylie. You're talking to the representatives and the senator for the 49th. I serve on the Rules Committee, the Finance Committee, the Innovation, Technology, and Economic Development Committee, and the Transportation Committee. Our session ended March 12th. And it was all about the virus towards the end when we rapidly put some things together, and we'll tell you about those during our town hall. I'll kick it over to my senator, Annette Cleveland, now.
Good evening, everyone. Thank you for joining us tonight. While we had what was a very successful and productive session, and ordinarily at the end of session, the three of us host for you an end of session town hall to share with you the highlights and the accomplishments of the session. I will simply say that we put forward balanced, responsible supplemental budgets again this year that prioritized education and healthcare and affordable housing and homelessness, the environment, as well as a strong economy. And we also ended the session on time. This is the third year in a row now that we've ended on time. But you know, this year when we adjourned, we also knew that what was ahead was the biggest challenge yet, and that was meeting the challenge of the pandemic head on. So tonight, what we hope to focus on with you is sharing a little bit about our state's response to the coronavirus, as well as hearing from you, your questions, your concerns, and your personal stories. So thank you for joining us, and appreciate everyone being here tonight.
Monica?
Thank you, everyone, for joining us this evening. I'm Monica Stonier. I represent the 49th District along with my able seatmates here, and very proud and thankful to have the opportunity to do that. I serve on the House Education Committee, on the House Capital Budget Committee, on the Rules Committee, and on the Health Care and Wellness Committee on the House side. I've also had the privilege of serving my caucus as the majority floor leader on our leadership team, and work as the chair of our Working Families Caucus as well. So we all have a lot of different areas around the policy committees that we cover, and I think before you have three legislators that do our best to try and cover as many different broad areas as we can. And so we're interested in the questions you have related to the policy and budget there, but we, as the senator and Representative Wylie have stated, have been very focused on being the best resource we can be for all of you when it comes to what information you need and resources you need in order to navigate this challenging time. So we hope to provide more of that for you this evening as well. Thank you all for joining.
Thank you. I'd like to start with Dr. Melnick's presentation, and then we'll go into a little more depth on the state response and the federal response that we're prepared to talk about. Dr. Melnick?
Hi, I'm Dr. Alan Melnick. I'm the Public Health Director and Health Officer for Clark County. And I'm going to go, is it okay if I go ahead and share the screen now?
I think that'd be great, sure.
Yeah, go ahead and do that. I'll start the slideshow. Great. Everybody hear me okay?
I think so.
Okay, good. Okay, so I'm going to give a little update on COVID-19 and where we are. I'm going to start with the at the highest level, well, at our national level, then go talk a little bit about what's going on in the state. And then I'll talk about what it looks like in Clark County. And then I'll give a little information about what we're doing in terms of responding to COVID-19. So just, and these numbers change. This is as of earlier today. There's been about 580,000 cases of COVID-19 and a little bit over 22,000 deaths in the United States. And then there's 55 jurisdictions reporting cases, including all 50 states. This gives you an idea of the number of cases. The darker colors are the states with more cases, and you can see Washington is fairly dark because we had the first case, and there are number of cases in Washington State, a lot of them in the Puget Sound counties. This is what we call an epi curve. It's basically looking at the total. Well, actually, it's just a curve of the total number of cases, and you could see, in mid-March we had very few cases, and then we've seen this exponential rise in the number of cases in the United States. Washington State, we've had over 10,000 cases, 541 deaths in the state. You can see one of the things we've been following is the percent positives and the areas of the state that have a higher percentage of lab tests that are positive for COVID-19 tend to have more of the infection in their community. The state, those counties in the Puget Sound area, around 15%. The state average is about 8.7%. That is going to change, and I'll talk about that a little bit. We've had like nationally in the state, we've had a lack of available testing, and more testing has come online in the last few days, in the last week, and a lot of people, a lot more what we call point of care testing is available. Those are rapid tests, and not all the negatives are getting reported. So those percents will become less reliable, but we'll actually get more testing done and find more cases. So, but these are the counties in the Puget Sound area have been hit the hardest in terms of the number of cases and deaths. This is a curve of this we call an epi curve of the confirmed cases in Washington State, and it looks like it's going down there on the right, but ignore those little bars on the right there, because it takes a few days for the data to get entered. So the numbers have actually been going up over time. And this is a curve that shows you up until April 12th, the cumulative number of cases in Washington State. And you can see that curve is going up. This is a curve of the number of individuals tested by specimen collection date. The orange colors on the bottom are the tests that are positive, and you can see compared to early March, there were more cases that were positive. Ignore the bars on the right because it takes a while for data to get reported. And actually what's going to be missing in terms of the total number of cases, the total number of cases will be missed. The total number of tests will not be portrayed in the future, because a lot of people are now getting what we call point of care tests, and the negative tests won't be reported, but we will be reporting out on the total number of cases of positive tests. This is a depiction of the age and breakdown of our confirmed cases, laboratory confirmed cases, and you can see a few more females and males. That could be a function of who's getting tested. For example, healthcare workers are more likely to be female than male, so that could be. The other point I want to make is that you can see that the confirmed cases by age group, and I want you to pay particular attention to the 60 to 79-year-olds which account for 25% of the cases, and 80-plus-year-olds who account for 10% of the cases. And as I show you the next slide, even though 60, 79-year-olds account for 25% of the cases, they account for 36% of the deaths. And even though 80-plus-year-olds account for 10% of the cases, they account for more than 56% of the deaths. This is a disease that particularly hits older populations in terms of death. The other point I want to make is that even though more women than men are confirmed cases, you see that we have a higher percentage of deaths in men. And not only does this disease cause more mortality in older people, but it also causes more mortality in men. What's happening in Washington isn't really different than what's happening in the United States as a whole, as well as globally. This particular infection hits older people and hits men harder. This shows you a breakdown of confirmed cases by death and race ethnicity. And in Washington State, we're basically seeing fewer of the, we're seeing 56% of the cases in whites, even though they make up 68% of the population. You can see there's a much more higher, even though Hispanics make up about 13% of the state population, you're seeing 24% of the cases there. So another thing that we're noticing both in Washington State as well as elsewhere in the United States is that this disease disproportionately hits ethnic and minority populations. You can see that non-Hispanic Blacks make up 4% of the population in Washington State, yet we're 6% of the cases. Here's another depiction of Washington State about deaths by gender, age group, and race. And you can see that the deaths, we're seeing more deaths in non-Hispanic white populations. I think more of the cases are there, and that's why we're seeing that. This is a graph of emergency inpatient admissions. As you can see, for COVID-19 like illness. And the point I want to make about this graph is, as I mentioned earlier, there wasn't a whole lot of testing available in Washington State or elsewhere until, and now we're getting more testing online. So to get an idea of what's going on in the state and in the country, we look at other measures. And one of the other measures we look at are hospitalizations for people with COVID-19 like illness. COVID-19 like illness is a syndrome of fever, cough, and shortness of breath, those lower respiratory symptoms, in people who test negative for influenza. So you see, starting around late February, early March, the number of hospital admissions, even though we didn't have test results for a lot of people, the number of admissions for people who had COVID-19 like illness began to increase. And and ignore the gray bar on the right there, because there is a reporting delay for some of these data. You may have heard about modeling that's been done. The University of Washington actually takes a look at available data, particularly the death data, and does some modeling. This is kind of like weather forecasting in a way. It's not a complete exact science, but the University of Washington has done some modeling about where we're at in terms of COVID-19 in Washington State. I don't have the data for Clark County because the numbers get pretty small. You need bigger numbers to do the modeling. According to the model, there's actually some good news here that in terms of resource use, and what we mean by resource use is the impact on the hospitals, not only in hospital beds, but also in critical care, ICU beds and ventilators. We've reached the peak resource use on April 5th. The other point I want to make about this peak resource use is, we're all aware that we've been using a lot of social, I'm going to call it not social, but physical distancing measures. That it's been very difficult for a lot of us because we've restricted social gatherings, groups of people, all the things that we like to do, and it's been really difficult. One of the reasons for doing that is to obviously prevent infections and deaths, but one of the other reasons for doing these physical distancing measures that have been pretty harsh is actually to reduce the resource use in hospitals and preserve hospital beds as well as ICU beds. And the little dotted line on the bottom there is the graph of ICU use, and the green line is the number of available ICU beds. And the good news is, largely because of our physical distancing measures, it looks like, according to the modeling, that we will not exceed bed capacity, nor will we exceed ICU or critical care capacity in the state of Washington. If I showed you a model from much earlier on, before we did these measures, it looked like we were going to, run out of ICU beds. So this is kind of good news. But again, it's a model, and it's also predicated on continuing the physical distancing measures that we've already been doing. This is a model of deaths per day, and we reached the peak on that 9 days ago, and we're hopeful. This big like orange blob there in the middle is the amount of degree of uncertainty in this model. So that dotted line goes down the middle, and it looks like deaths will be dropping, but again, it's a model, and there's some uncertainty there, but we're actually pretty hopeful that we've past the peak and the deaths per day will be dropping. Again, if we continue the physical distancing measures that we already have in place. This is a graph of the model shows that what the total number of deaths will be if projected by August 4th, if we continue what we're doing. Now down to Clark County, we're now up to 258 cases. This is earlier today. This number changes. We've had 15 deaths. We've had 2,607 people tested, but that's testing that's gone to University of Washington, the State Public Health Lab, and some of the private labs. We are now really getting on board. And you, by the way, you may have heard that there was issues with how long it takes to get a lab result, people not getting tested, lab turnaround. We're now moving, and I'm going to talk about this a little bit more. As the supplies improve, we're moving towards rapid point-of-care testing, where you can get results in positive results within 5 minutes and negative results within 13 minutes. The good news about that is we'll get cases reported quickly, and we can respond to them. The mildly bad news about it is the negative results will not get reported, so we won't have a robust measure of the total number of people tested. These are cases and deaths by age group in Clark County, and you can see that Clark County is not unusual in that we're seeing a much higher death rate in older people. And this is, we've had a lot more cases in women than men, 151 to 107, but you can see 13 deaths in men and 2 in women in Clark County. So more cases in women, more deaths in men. These are COVID test cases by test date. I'd ignore bars all the way to the right because there is a little bit of delay in reporting. The number's been going up, as you can see, in terms of the cumulative number of cases. Each one of these bars represents cases per day. We originally, and if you go on our website, you can see this map of cases of the zip codes in Clark County. We originally put the number of cases on there for each zip code. It raised some concerns that people were interpreting this as the darker colored zip codes were hotspots. They're not hotspots, and for a couple of reasons. One is each zip code has a different population. So obviously zip codes with more population by chance are going to have more cases. So what we did was we changed this to what you're looking here as a rate map. So it accounts for the difference in population between the zip codes. But there's another point why the darker colors are not hotspots. Is that these cases are reported not by where somebody acquires the infection. They're reported by where somebody who has the infection lives. So, for example, somebody could have been on a cruise ship and lived in one of these zip codes and was a case, but not because they acquired it in the zip code. It was because they live in the zip code, and that's where it's reported. But people want to know this, so we want to get as much information out to the public as possible, so we produce these maps. We're particularly concerned about long-term care facility outbreaks, and we originally listed the long-term care facilities by name. We got a lot of concerns about that, mainly because, again, the interpretation of this is just because you have a case in a long-term care facility doesn't mean that there was transmission in the facility or somebody acquired it there. It's based on where somebody lives, and they could have acquired it elsewhere. So we're listing it by type of facility. So the adult family homes are the small long-term care facilities where I believe 6 beds or less, and then assisted living and independent living and skilled nursing facilities. And those are what we're looking at now. We're also interested, and I believe we're posting this on our webpage as well. We're continuing, even though the modeling looks good, we're continuing to look at what our hospital bed capacity and ICU critical care capacity is. And as you can see, we're not even anywhere close to exceeding that capacity right now. One of the reasons is we're aggressively doing the physical distancing. You may also note that one of the ways to reduce hospital bed use was to stop doing elective procedures. So that's helped as well. I mentioned when I showed the state map that because we didn't have robust testing available, one of the things we're looking at is people with COVID-19-like illness. And this is a map of emergency department visits for people with COVID-19-like illness. Again, that's having a fever, cough, shortness of breath, and not having influenza. The light blue graph is the current year. CDC week 1 is based on the calendar year. So week 1 is, the first week of January. The darker blue line is people who had these symptoms last year. And you can see that, and I could show you years before that, but what's unusual this year is that there was a peak beginning in around week 9, starting in March. We had a peak, we started seeing rapid increase in COVID-19-like illness at Clark County emergency rooms. This was not influenza, and the only other thing we knew what was going on was COVID-19. So it's likely, there's a good chance that these are COVID-19-like patients showing up in emergency departments. The good news is it looks like the number is going down. Similarly, these are hospitalizations for COVID-19-like illness at Clark County hospitals. And again, compared to the previous year, that went up, began going up late February, early March, but it looks like it's coming down. So I'm hoping that trend continues. We're still having issues with supplies, and they're getting better, but a lot of people have said, well, I've gone to my doctor and they can't test me for COVID-19. The issue has been all along that it's not just the laboratories itself, it's the supplies that doctors need to test patients. So there's been, for example, the Q-tips that you use, the swabs that you use to get the specimens have been really short supply. The other thing that's been in short supply has been personal protective equipment. But both things are getting better. And like I said, we are now having point of care testing becoming available. This is what we're doing right now. We're still, when we get a report of a positive case, it's notifiable by law to the local health department. So anybody who lives in Clark County who gets a diagnosis lab report of COVID-19, it gets reported to us. we're contacting all confirmed cases, and if they're lower risk folks because of our resource limitations, we're giving them information that they can give to their close contacts about quarantining themselves. And what we mean by a close contact is a household member, somebody that who a confirmed case spent more than 10 minutes within 6 feet of that person, or somebody who was coughed or sneezed on by a confirmed case. So we're contacting all confirmed cases, and we're giving them information to give the close contacts. We're particularly concerned about cases who are in high-risk situations like healthcare workers, long-term care residents and staff, or somebody, either staff member or inmate in the jail or detention center. For those cases, we're also doing interviews with the cases. We're identifying who their contacts are, their close contacts, and we're contacting the close contacts directly and making sure they have information about being quarantined for 14 days. We're actually working with the Clark County Jail as part of a contact investigation for, there was a recent inmate there who tested positive. Inmate is not there anymore. We're also testing all residents and staff at long-term care facilities that have had a confirmed COVID-19 case in either a staff member or a resident. And actually, we've got a great partnership with a Vancouver clinic they're using point of care testing to do universal testing of these facilities, whether they've been a case in staff or a resident. Another population that we're particularly concerned about is are people who are unhoused, and we're actually working again with the Vancouver clinic to start doing some testing of symptomatic people with symptoms who are unhoused at the shelters, and we've identified housing for them, both for isolation for people who are infected and quarantine housing for their close contacts to keep this disease from spreading in that population. We're going to continue case updates on our website. So if you check our webpage, and we can get everybody the information for that, we'll be putting new numbers up there every Monday to Friday around 11 a.m. And I think that's my last slide.
Thank you, Dr. Melnick. And you'll be able to stick around for some questions later. I lost your sound.
I'm staying around for the duration, and I know I spoke really quickly, so I'll be delighted to hang out and answer any questions that people have.
Thank you so much. I'd like us to move into our updates on state and federal response and next steps for the legislature, and then we'll start working our way through the questions. Senator Cleveland, would you like to kick off talking about our state legislature funding bill, House Bill 2965?
Yeah, I'd be happy to. Thank you, Representative Wylie. Well, in the final days of the legislative session, we fully recognized that we were facing a tremendous challenge like none we've ever seen before. And as a result, we put forward House Bill 2965. And within that bill, we dedicated $200 million toward our state's response to the coronavirus. While we purposely left much of the language of that bill broad so that we could then meet any of the potential needs that might arise that we couldn't possibly guess at that time. What we were very specific about was appropriating $25 million of that funding to go toward those people who were unemployed as a result of this situation that we face. And we were very clear in ensuring that we want to do all we could to support those individuals who are facing job loss, and to also help support our businesses and our small businesses who are, as we know, struggling. So in addition to the funding that was appropriated in that bill, want to also share that we did take steps to reopen our health benefit exchange here in the state so that those without health insurance could have the opportunity to enroll in benefits that they might need for themselves and their family. We also took steps beyond the House Bill 2965, the funding for the coronavirus response, to also address funding for a coronavirus response call center. We also increased our primary care physician Medicaid rates, as well as our behavioral health physician rates, because we understood that they're not adequate, and we were going to see an increase in need around those services. We also increased payments to better support our rural health clinics, and provided some Medicaid reimbursement increases for our nursing homes as well. We designated $17 million additional dollars for our foundational public health efforts, and I want to specifically say thank you to Dr. Melnick for his expertise, his guidance, his leadership throughout this entire coronavirus response, and for what I'm sure will be his continued help as we move forward. And then also want to mention that we appropriated $51 million additional dollars to help meet the increasing demand on our new paid family leave program here in the state. So those were some of our focuses in ensuring that we would have the resources individuals in our state could access as we together continue to meet this tremendous, unprecedented challenge.
Thank you. I also would like to point out that states can't do deficit spending, and we had a very robust rainy day fund, which helped pay for that, as well as the governor refraining from acting on some of the new spending and slowing down spending wherever possible, so that we were able to focus on health. And there's going to be more budget decisions in the future, in our future, and I'll talk a little bit about some of the federal help that's coming. But I'd like Monica to talk about some of the next steps that House leadership and the Four Corners and the governor are talking about. Monica?
Certainly. Thank you, Sharon. We know that not only do we appreciate the governor's effort to take a look at the bills that we passed this year and the impact that they would have on the budget, all of those bills would have been an increase in investment over last year's biennium budget. So the vetoes and the use of the governor's pen really reduced new investments. And so we're appreciative that he took a very strong approach to making sure we have the resources we need. It's difficult sometimes as a legislator to work really hard on policy, and then after it's passed to acknowledge that the best thing is to see those investments go into the health and safety of our state rather than the policy that we worked hard over session for. So a lot of us as advocates, a lot of you who supported bills over this session are probably feeling a little bit of that. But as we move along, we know that we're likely to head into a special session this summer, because if we do not address the budget shifts that we need to make for the next, for the remaining of this fiscal year and in preparation of the economy in the world of COVID, then we're going to be in a position where we're going to have to make more drastic cuts down the road. So we want to be as careful as we can, but also be sure to have the economic forecast and the data necessary to make smart decisions as we go forward. So we're going to be looking for that sweet spot to return back and do that hard work. Unfortunately, when we go back to session, many of you are very hopeful that we'll get to work on policy that you would like to see passed. I want to share with you right now that when we go back for a special session, it will be very focused on the work of preparing our state for the economy in this world of COVID and making sure that our communities are protected and healthy. So a lot of the policies that we may be willing to take up in the future will probably not be considered for a special session. So I like to share that up front. We're not sure when that will happen yet. However, one thing that we have been hearing a lot about here in Southwest Washington is what will the reopening of business and public spaces look like? And I know Dr. Melnick can attest that that's a conversation that's going on across the state. And one of the things we have to do is take into consideration, what does the pandemic tell us in data in terms of transmission and in terms of what that safe reopening can look like. So a lot of our inbox email has questions like that in there, and we're taking a very close look at what reopening can look like. So for example, if you're a business that can do something by appointment within guidelines that keep people safe, you may be on the next list of consideration for the governor to consider. If you are not a service or a business that can operate with compliance to the stay home, stay safe, and distancing regulations, it will be longer before we consider those businesses for reopening. But it is time to start thinking about how to keep the economy going again. The number one goal will be to ensure that we don't do it in a way that undermines the progress that we've made. So that will be our focus when we head back, and we're looking for feedback from you, from the community, from our business community, to help inform our steps as we move in that direction, and we welcome questions along those lines as well.
Thank you, Monica. And I'd also like to mention that we will be in a position to continue to be advocates for people's real needs as the state makes decisions on what to do further and what we advocate for at the federal level, because there will be more federal actions taken. And I'd like to talk a little bit about the CARES Act, because that's a very important part of the state's response. And I know that some people I know have gotten their stimulus checks today or yesterday and are feeling really grateful for that. But we did get quite a few resources. It sounds like a lot more than it is, and it's hard to unpack it and wrap our brains around what sounds like a lot of money, but is also directed towards a lot of need. The state coronavirus relief fund received $1.624 billion for state government and $1.329 billion for our local governments, for a total of almost $3 billion. And that's been allocated and is being allocated where it will do the most good and serve the most needs. Child Care Development Block Grant got $58.2 million towards helping child care providers during this unprecedented crisis. Community Services Block Grant money was $11.8 million for community-based organizations that provide those important safety net social services and emergency assistance to those with the highest need. There is additional money for low-income heating assistance programs. We're heading into the warm climate, but there will be people that need help with their utility bills. And then $56.6 million for education stabilization and $216.9 million for elementary and secondary education to help the schools pursue the technology they need in order to provide distance learning. All of that is going to be very critical. And I can't help but think that this is going to accelerate a lot of trends that were already in process. And being an optimistic soul normally, I have to feel grateful that we are a high technology state, and technology is one of those areas where as much as I would rather hug people and shake their hands, technology is what's going to allow a lot of people to earn money and support their families and keep a good portion of our economy going. So that's going to be critical, and we're going to, I think it's going to accelerate our movement towards a more digital and well-connected state, both in terms of healthcare and education and communications. So with that, Grateful for those federal dollars. There will be more, and we may have an impact on that. So having our constituents reach out to us, tell us what you see, tell us what you need, and we can add our voices to make sure that future packages address those. With that, I'd like to start with some of the questions we've got, because that's the most important part of this this event.
Great. Well, the first question we have is from Nicoletta. Her question is, what is the level of coronavirus testing in Clark County by percentage of population? And are enough people in Clark County practicing social distancing and or wearing masks?
I think we all have an opinion on that. Dr. Melnick, you want to take that one?
Yeah. So as I mentioned earlier, testing has been inadequate for a long time, and we're just getting to the point where we can do point of care testing, which means right when the getting the results when the person is in front of you. We're still getting testing supplies, but I could say a pretty small. We have a population about 500,000 folks here, a little bit under that, and we've tested a fairly small part of that population. If I have time, and I hope we have time, I'll tell you what we need in place, what we're going to need in place to move away from this physical distancing, and maybe we'll get to that in a few minutes. In terms of so given that testing is coming online right now, what we're trying to do is get to the highest risk populations, and that's the long-term care facilities. It's people at the hospitals with COVID-19 like illness. It's the unhoused population, because they have difficulty. First of all, it's a population that has, many of them have other conditions that put them more at risk. And there's difficulty in terms of their living situations to be physically separated. And then we're looking at the jail population as well. But I think for everyone, more testing is going to be coming online. It's just a matter of getting the testing supplies. We're still, again, it's still the swabs and what we call the viral transport medium, that little liquid that goes in the tube, and you put this, you get the specimen, you put the swab in the tube, that little liquid, that's been in short supply as well. So we're moving in that direction, but it's, there's more to come. So hopefully we'll get more people tested, because I'd like to see that happen. We should have had more people tested 3 months ago, but that's another long story that we can talk about. But the more people we get tested, and the more people we're able to test, the easier it'll be to move away from the physical distancing. And I'll talk about that in a few minutes if we have time. In terms of people, I think our community has been really good about physical distancing. I think there's been some exceptions, and we've had to take some steps. So besides covering Clark County, I also cover health officer services for Skamania, Cowlitz, Wahkiakum, and Pacific counties. And I'll give you a good example. I always thought that the clamming was a solitary thing. You go on a beach and there may be people a long way away from you clamming. But we actually had to ban clamming in Pacific County because there was a clamming festival that was going to go on with thousands of people from out of the area converging on the beach. Likewise, in Skamania County, we had to actually restrict access to Dog Mountain Trail, because I would think, you're in the woods and there aren't going to be a lot of people around, but a lot of people were congregating. So there have been exceptions, but for the most part, I think people have been really pretty good at the physical distancing. And I think, so that's been working well. I want to make a couple of points about masks. And we are recommending, you might notice that the CDC has recommended that people wear masks when they go out in public now. There's a couple of points I want to make for that. First of all, we're hoping that people are not wearing medical masks, because those are still in short supply, and we need them for medical people who are most at risk, and first responders and so forth. The main purpose of wearing the cloth masks in public is not to protect yourself. That there's not great evidence of how effective cloth masks are in terms of getting the infection from somebody else. The advantage of wearing a cloth mask, and the reason the CDC changed the recommendation, is now that we have a few months of experience with COVID-19, like COVID-19, the virus, which is SARS-CoV-2 is the name of the virus, actually. COVID-19 is the disease it causes. There's a lot of people who don't have symptoms, we call them asymptomatic, and there's now evidence that they can transmit the infection. So the idea of wearing masks, for all of us to wear masks when we're out in public, is to prevent other people from getting, if we're carrying it and we don't have symptoms, of course, if we have symptoms, we should stay home. But even when we don't have symptoms, the idea of the masks is to prevent us from infecting other people. That being said, I want to reiterate that masks are not a substitute for the physical distancing. All the other things that we've recommended to people about being at least 6 feet apart, and washing your hands and not touching your face and nose and all those other things are still really important. I'm not doing a survey about whether people are wearing masks. What I hear anecdotally that people are wearing masks when they go out in public. So that was a long-winded answer to your question, but
Okay.
I hope I answered.
Thank you. Thank you so much. Another question, and we're getting a good amount of questions, but people can ask a question by commenting on the video. So let's move on, Travis. More questions, please.
Great. The next question's on unemployment benefits. And this person says that they are a self-employed gig economy independent contractor, and they want to know if and when they can file for unemployment.
I think one of the best places to find that out for a particular case is our state website, which is, coronavirus.wa.gov. In preparation for this, I looked at that website, and it has both federal, local, and state windows into almost anything anybody could ask. And so I think that would be the best place to start. Every case is a little bit different. I know that our unemployment insurance system is really overwhelmed, but I know that there's, and some of the funding comes from the state and some comes from the federal government. So it's really best to go to that website and then go into the other government, and there's lots of Q&A. There's also places for if you're an employee versus an employer, and get back to us if that doesn't help. Monica, do you have additional information?
Yeah, we actually can post the link in the comments on the House side, and we'll make sure that we send that over to the Senate side if Senator Cleveland doesn't already
Great.
have it handy. But we do have links to the unemployment resources. There's a checklist that has been incredibly helpful for people who don't want to sit on the phone and don't want to clog up the phone lines to determine their eligibility before they actually get to that point in time. For people that are self-employed, those opportunities you can apply, and I believe that April 18th is the opening date for those applications to begin. It is true that the office is overwhelmed. If you can imagine, if you're a business owner, the capacity for a day's business increasing by 1,000%, it would be really hard to meet that demand. But Department of Commerce and our state agencies have been working on staffing up and increasing their hours around the clock to try and meet that demand. So I think we're going to see not only the wait times go down, but also the response time go down here very quickly. I would say that it'll save many people time if you take a look at the checklist that's going to be on this page first, and then also sign up for updates, because if there is a point in time where somebody who had been denied access in the past, if there's criteria that changes, we want you to know that those changes have happened so that you can have your case reassessed. So take a look at the comments on our pages, and we'll make sure that those resources are posted. Also, if you're not following our legislative updates through our offices, I encourage you to sign up there. We've been putting a lot of information out in our updates, and I know that Senator Cleveland on the Senate side has been doing the same. So I encourage you to go to our legislative websites and sign up for our newsletters and updates.
Thank you. Questions?
Great. And our next question is from Idri. Idri asks, what can the three of you do to make certain our county election staff is protected this election and the upcoming August primary and November general elections?
Oh, I'm so glad that question came up. I was holding myself back from asking Dr. Melnick about what are the exact things that need to be done for processing our mail-in ballots to keep the people doing the work safe. So I know that we are all concerned about that, and specifically what kind of equipment and materials do they need?
Yeah, I think that's a really good question. I think handling the mail-in ballots is pretty low risk. It doesn't, the virus doesn't really survive on that kind of surface really well. I know that when I take in my own mail, I generally use hand sanitizers on, after doing that. So, I think we need to have that in place. And actually we're already having people, I don't think people need to wear medical masks when they're handling ballots. I think, having hand sanitizer around and avoiding touching their nose and face is a good idea. I mean, you could wear gloves. The problem with gloves is if you touch something with a glove and then touch your face, you're in the same position if you use your hands. So, and obviously the people who, if they're counting the ballots, the people working with the ballots, we need to have an adequate physical distance between the people who are counting the ballots.
Thank you.
I don't think they need to, other than, the masking that we're recommending when people go out in public, they need to be, they're in a public setting, but I don't think the virus is going to jump off the envelopes, for example.
Make
but
sure
I think
it happens in a room that's big enough for everybody. Yeah.
Yes.
Okay. Another question.
Great. The next question is from Joe. Joe wants to know, did the state take steps this last term to address the housing crisis? Also, what steps would you like the state to take with regards to housing next session?
Yeah, so the last couple of years, we've taken a much more strategic response to the housing crisis we're facing as a state. The operating folks that work on the budget there have been working closely with the capital budget people that build the infrastructure that would be necessary. And by having those efforts where we as legislators can look at those in partnership with one another has really made a difference. In the capital budget, for example, and this is a budget that's not impacted by the governor's vetoes, we have $60 million for permanent supportive housing that was increased this year, $15 million for shelter capacity grants, another $15 million for rapid response, and $10 million for preservation, which would be repairs and maintenance of the housing trust fund projects. There's a good amount of effort not only going into infrastructure, but also thinking about the policy. For example, allowing people to pay certain sums in installments without risking eviction helps people stay in homes longer. We have a council of another bill where the local jurisdictions have the opportunity to use some tools that the state has had in the past to help on a local level. So we were able to do some work this year, but we know that these people who are unhoused currently are also in the category of those that are untested and unknown in terms of data when it comes to the pandemic that we're facing. So we have to, that's one of the reasons why when we go back for a special session, we want to make sure we're paying close attention to those that are not only impacted, but are not in our data set. And we'll continue working on that. Thank you for asking the question, Joe.
Thank you. Good question.
Great. Our next question is from Chris. Chris wants to know, what is the state of our rainy day fund and how does the legislature plan on addressing the budget shortfalls over the next few years in light of the McCleary decision requiring the full funding of basic education? Are legislative leaders looking at additional revenue sources like a state income tax or raising corporate taxes on big business?
I think there's a lot of unknowns. Annette, do you want to, I think we all need to chime in on that one. Annette, do you want to start?
Yeah, absolutely. And I appreciate the question very much. And I will say that we've been working very hard to ensure that, as I shared in my opening remarks, that we deliver very balanced and responsible budgets. And as a result of that, one of the things we can point to is the fact that for the very first time in our state's history, we received a AAA rating from Moody's. And in addition to that, for the very first time in 20 years, our state's credit rating has been upgraded. And, I think that is proof in and of itself that that our budgets have been very responsible while ensuring that we're paying appropriate, adequate minimum wage and living wage jobs and providing healthcare access and ensuring that we have a strong economy. The rainy day fund, off the top of my head, I don't recall the amount that we left in the fund after we passed the coronavirus response bill, but and I don't want to say off the top of my head. I'm thinking there was a healthy balance left in that fund. We don't want to rely on that fund as a way to sustain the budget. That's not what it was intended to do. And so we will be assessing once we have a better idea of the full economic impact of the pandemic on our state's economy as a whole. We'll then be able to better assess what steps we need to take to address any budget shortfalls.
I'd like to chime in before, and then Monica, I'm sure, has some good information too. A number of years ago, our state reduced the amount of regular revenue that is bondable for capital budget requests, knowing that capital budget is what drives a healthy economy, particularly for infrastructure. That's what gets people back to work, and it generates so much more than what it costs. And part of the reason for that was so that in tough times, when we're really have our back up against the wall, we will have capacity to make those investments in jobs and infrastructure that set us up for long-term economic health. And so a lot of the things we've done historically are different than what other states have done, and I'm very grateful for those. That's just one thing. Monica, do you have some things to add to that?
Sorry, I was on mute. I was trying to make sure you didn't have to listen to me, my keyboard. Yeah, I think, the senator makes a good point. We certainly have, we had about a bill with $250 million that we authorized from the BSA this year. We are likely to revisit that. It would not make sense for long-term economic sound budgeting for the state to continue to use that as a resource when we can go back and take responsible action on our underlying budget, which is going to be, the effort that we make moving forward. But at this point, we are looking at, I've seen anywhere from 1.8 to $3 billion a year in cuts or in lack of funding for each year for the next several years. So that means it's a significant effort to try and get back to a place where we are balanced at the state and not using the budget stabilization account, otherwise known as the rainy day fund. Otherwise, we would not be in a position to respond the way that we did to keep the state in good or as good as possible condition moving forward. We'll continue. We can keep you updated on that. The way that the BSA can be accessed and policy or votes that are necessary to meet the threshold changes depending on what the forecast tells us and depending on what revenues in good times look like. So there's constitutional or legislative thresholds we have to meet in order to access that. But you can certainly expect us to keep you updated as we move forward.
Yeah, I think being transparent about it is going to be key, and it would be a lie if we said it wasn't going to be tough. We've got some real challenges ahead. More
Sharon,
questions?
could I add to that, however?
Sure.
I'd like to just add that we are now very focused on talking about, as we prepare for the next steps in addressing this pandemic, we fully recognize that what's going to be necessary is tremendous effort to help spur our economy. And some of the things that we're talking about is ensuring that we're investing in infrastructure, whether that's transportation, whether that's broadband, whether that's public works. We know that investment in infrastructure helps spur economic development, helps to spur job growth. And so as a part of addressing revenue shortfalls that we're most certainly seeing as a result of this pandemic, we also know that it's as important, if not more so, to take steps to shore up our economy and help to spur economic growth that we need.
The one piece that we didn't address in the question, I think, was what revenue options we're considering moving forward. This is a time where it is going to be incredibly clear to us as a state that those who are most impacted in our communities by not having jobs, by not having paid family leave, by not having sick leave, by not having protections in situations like this are the most likely to be impacted and potentially homeless or without work in the long run. And so the upside down and regressive tax structure that we have in this state is one that is going to be a blinding reality for us moving forward. So any of those revenue options that you are thinking that we should consider, we're open to taking that on, because we're going to need to have every tool on the table for consideration moving forward. And it's a time for us to really feel the impact of the regressive tax structure we've had. And by regressive, I mean that those who make the very least in our state pay the highest percentage in taxes of their income, and that makes it incredibly hard for them to survive. And so it's time to take a look at that. We want to make sure that when you ask about revenue, we're going to look at all options.
Thank you.
Great. Our next question comes from Ellen. Ellen wants to know if there's any information for when all construction will be back, not just residential construction.
So this question of construction is one that is a daily occurrence in my day. I don't know about, I'm sure for my seatmates as well. And I know that Dr. Melnick gets this question quite often too. And, I think, like I said at the top of the town hall, in the conversations that I am having with folks who are working with the governor's office and the health experts, knowing when we can do that safely will be determining when we get those open. And right now we are a little early in the data of the pandemic on the opposite side of the peak, than we are at the beginning. So when we get that information about how transmission is looking, how businesses are able to comply with health standards, we'll have more information. Unfortunately, that's one of the reasons why this question comes up every day, is because we're not going to have clear answers until we have better data. And I'm sure Dr. Melnick has something to add.
Yeah, so thank you. The question about, when can we get back to work and when can we get the economy going? So I want to, there's several things we're going to need in place. And let me preface that by saying we're dealing, first of all, most of us are still susceptible, because as horrible as this has been, a relatively small percentage of our population has become infected. So we have a lot of susceptible people out there. This is a virus that is fairly contagious, and it has a high degree of mortality, and like 10 or 20 times as fatal as influenzas, at least from the information we have so far. And the concern is, given that so many people are still susceptible. If we relax our physical distancing measures, this thing can come back horribly so. So there's a few things we're going to need in place, and I'm going to mention 3 of them before we can really look at this. One is we're going to need to have much more robust testing available. So we can actually identify, and point of care testing, so we can identify cases really quickly, do the interviews with them, identify who their close contacts are, and really quarantine them and actually actively monitor them. And that's an issue I'm going to talk about in my 3rd point coming up in terms of the workforce we're going to need. So we're going to need more testing available so we can better characterize this. Another thing we're going to need in place, and you may have heard about serology testing. We're going to need serology testing is a blood test for the antibodies. We're going to need that developed. There's still some questions about it. First of all, the test itself, and also we're going to need to demonstrate if you have antibodies, what does that mean, and what level of antibodies do you need that to connote immunity. You might recall when we were dealing with measles, last year. It's a distant memory now, but when people couldn't identify whether they'd been vaccinated or not, we used a blood test to check their antibodies to measles, and there was some good data about what level of antibodies connotes immunity. We don't know that yet for COVID-19, but when we get there, we'll be able to identify people who, especially essential workers, who, if they have adequate antibodies, can go back to work and not worry about getting infected. The third thing we're going to need in place, and this is a conversation that's actually happening right now between my colleagues in the state this evening, is really beefing up our, when we get the numbers down enough, is to really beef up our public health workforce, and there's funding for this, so that we can actually do this really intensive. If we had done this in January, if we had adequate testing available, we might not be at the point where we're at now, but we're going to really need to be able to identify cases quickly through testing more people, doing those intensive interviews with them, finding where they were when they might have been contagious, and that, which includes before symptoms develop, and then identifying their close contacts, and not only quarantining them, but monitoring them in quarantine, calling them every day, making sure they're staying home, and if they get sick, testing them. We're going to need to have all those things in place. And hopefully, we're going to be working on that in the next few weeks. We need all those things in place to safely, really begin bringing people back to work. And the folks who do come back to work, we're going to need to basically do as much physical distancing as we can as people get back to work. But we need to have some big things in place before we get there.
Doctor, this is the perfect time to ask a question that I was asked. How hard would it be to have our blood banks screen for the antibodies in order to get an idea of how many people have really had it, and who would be, if the antibodies can be useful in terms of fighting the disease, how do you identify those people? A nurse asked me why we weren't doing that.
Well, that's a really good question, and I'm actually glad you brought it up, because one of the messages we've been giving out is that people have been afraid to give blood, and I think the folks who collect blood have been having difficulty. So I want to tell people that they have, it's safe to give blood, and I think the folks who are collecting it are enforcing physical distancing, so that's there. Once that test becomes available, you won't have to do it at a blood donation center. You'll be able to get the test. Once the serology test is involved, you can get the test in your doctor's office. It's just, anybody will be able to get the test. And I don't think I'd want to channel people to one location, because obviously we'd have lines forming there. But I think we'd be starting with people that are essential, and like healthcare workers, getting them back to work, early on. But the test would be able to be administered in any medical office, and I think. Again, we still have to work out the quality of the test, as well as what antibody level really connotes immunity, because we really don't have great information on that yet.
Sure. Do we have some more questions, Travis?
We will.
Sharon, while we're looking for another question, I just like to add to Ellen, to address Ellen's question further, that Governor Inslee has been very regularly meeting with industry leaders across all sectors, particularly the construction sector, and is working to develop plans for recovery and how it is that we can start to move toward reopening. But of course, our first and foremost priority is to keep people safe, save lives.
Can I add to that? I know that my colleagues have been having input with labor and industries and other folks about, especially around construction, what you need to have in place in terms of physical distancing, hygienic, disease control, prevention practices, hygienic practices that you need to have in place to make it as safe as possible. So I know people are working on that issue.
Sure. Travis, more questions?
Sure. We actually just got one. We actually got several from Diana over email, and I'm going to read this one because we haven't touched on it yet. Is there any discussion of freezing rent, lease, mortgage, or mortgages to protect renters and landlords?
I have not seen proposals that are considered right now with regard to the rent side or the mortgage side. We are looking at ways to offer some relief in terms of waiving fees or interest rates and things like that to kind of help as much as we can. We do have a moratorium on evictions, so people are not, while they're trying to make plans with those lenders or landlords for this tough time, are not at risk of actually losing their housing during this time. So we're encouraging folks who are concerned about that to stay in regular communication with their landlords, to have a plan in place and to be clear about what you are able to do as we move, as relief comes in terms of state and federal services, but just in terms of freezing rent and mortgages, that sometimes goes into a realm beyond what legislative purview can manage without being in session to actually pass the policies that would need to be in place. The governor has a lot of flexibility about what legislation on the books he can relax, but not necessarily in what he can enact if it's not directly related to health and safety of Washingtonians. So for some of those considerations, we would have to actually be in session to consider.
Plus, banks and credit unions are federally chartered, and there's
right.
federal laws that come into place. But I've heard that some mortgage holders are being flexible. Yeah. But I think it's on a case-by-case basis.
Great. We have, let's see, we have another question here. This question is from Hashim, who asks, what support is going to be afforded to community health centers in the region due to COVID-19?
Well, Annette is the chair of our Senate Healthcare Committee, who probably has some support on that, but I know that we all have been very supportive of public health funding, and it's likely to be a focus of attention when we go back.
Absolutely, and in fact, some of the interim plan for the Senate Healthcare Committee this year includes a closer look at our clinics and how it is that we can provide even greater support. Ordinarily, those interim plans include actual physical tours, and at this point in time, we don't know if those tours can take place or not, or whether we'll need to be looking for a way that we can conduct that work virtually. We're all trying hard to embrace this new world order here and get used to this new virtual world we live in. I can't say that that I'm very good at it yet.
A lot of the federal money was devoted to the Department of Health and local health departments. and so, and rural hospitals, a lot of it's heading in that direction, but it's real hard to know what that means specifically for a particular clinic.
Great. Let's see. Our next question is from Nick. Nick wants to know if there's been any updates regarding small business grants.
So we're probably trickling in information on this. We know that the grants application process was a little hard at the start because the county wasn't actually listed as a qualifying county. That was changed pretty quickly, but it may have slowed down the application process. There are a number of different ways and different types of programs. We're encouraging folks to start with their financial institutions to not only get a sense of the timeline, but also to make sure that you're working with somebody that you have a financial relationship with. At a time like this, we don't want third-party folks who are operating with a fraudulent interest to have access to the types of information that you would put on an online application. So starting with, for us in Clark County, it would be the Economic Development Council for small businesses, but also your own financial institutions, and then also looking into what the state agencies can have. What I can say from what I understand is that those applications are processing. They seem to be slow at start, but are picking up pace now in terms of turning those around and even delivering answers and funds. And I'm not sure if anybody else has heard more than that, other than the timeline is getting better.
That's what I've heard too.
Yeah, and we had an update today with our Department of Commerce Director, Lisa Brown, for members of the Senate, and understand that that some of that federal funding has now come into the state and has been distributed to our economic development councils, including our own Columbia River Economic Development Council. And I would encourage you to go to their website and look at the information that's contained there. And there's specific information as well as forms that you can fill out.
Thank you. More questions, Travis?
Yeah, absolutely. We've got a question from Monica, who asks in the comments, has hazard pay been considered for essential workers?
That's a good question. I've actually heard a lot of discussion about that today on an earlier call, on a federal call, working on things nationally. So hazard, I mean, something like that would definitely require us to be in session to consider to pass legislation in order to enact that for our state. But it would not be, I think, out of the realm of possibility to consider that, especially our frontline workers in healthcare and first responders, and I personally would add grocery store workers to that, that those people who have to go to work in order to keep people fed and comfortable in their homes could potentially be offered some kind of program or pay. Of course, that would impact the business that is hiring them, but there are some concepts out there, like, for example, if you offer what I think Starbucks is doing, offering hero pay for those who are able to pick up extra hours because their staff, some other staff, are not able to come into work. Those folks would be offered additional pay, and then we would relieve the business of the additional payroll tax on top of that. So whether it's considered hazard pay or just other strategies to try and keep more workers in the workforce, I think there are definitely some creative ideas circulating, but we would have to return to session for that to happen. But this is a good time to be talking about and asking those questions, so those ideas are fully formed before we get there. Senate, have you heard anything on the Senate side, Annette?
We have had discussions on several of the regular conference calls, and as I understand it, that's been largely a federal discussion at this point in time, and partly due to the reason you just shared, that we're not in session as a legislature.
Great. We've got a bunch more questions, so we'll see which ones we can get to, and I'm going to try to combine a few of these. We've got a couple folks who are curious and worried about the school closures. Particularly, there's kind of two areas here. One is when folks maybe start going back to work next month potentially, and what will they be able to do, what will happen with them and their kids. And then we also have a couple of comments here about students, especially those with the greatest need for special education services, life skills training needs, and the school environment that they need for learning. What is the plan moving forward with those students?
Yeah, those are important concerns, and I know that the frequency that those questions will be coming to us will increase as we start to see people go back to work on the other side of this pandemic. The schools currently are expected to not reopen for the rest of this school year. So what we're seeing teachers do currently is develop regular routines with their students, with when they'll be checking in and meeting with them or talking with them in some type of online format. For those that don't have access to that, teachers are going through their list of students and figuring out who needs a different strategy. For students with special needs, IEP needs, and have are supposed to be receiving services that cannot be provided in that form, districts are currently expected to continue working through their list of students to find out what exactly can be done to support those students by contacting their parents, reaching out to kids. It takes time to go through every student in our state and find out exactly what they need, but at this time in the pandemic, it's also a time of flexibility and understanding. So parents have some say in the level of engagement. We've heard everything from, and for those of you who don't know, I work for Evergreen Schools in special services as my regular job, not in the legislature. So we hear everything from parents saying, thank you so much to those educators that are reaching out and making regular contact with my kids and keeping them learning during this time, to the expectation that students have is really hard for that teachers have is really hard for my students with special needs, because they're receiving the same level and same amount of work as everybody else. And that's because teachers who know that those kids need some different attention are still getting to the point in time where they can deliver that. So there's directives both from OSPI, but to be honest, each school district across the state, all 295 of them, are working on developing those strategies that work best for their community. And so the questions, while they come to us, are very helpful to keep us posted on what's going on. At this point in time, the best place to get answers about how that's going to be delivered is through your school board and your teachers and your principals and your superintendent of the schools where your students attend, because they're the ones who are making the local based decisions at this point in time.
Thank you.
Great.
Travis?
Yeah, so I think we have time for a couple more questions. We have a question from Greg, and Greg wants to know, what does the budget, in regards to budget shortfalls, what does this do for plans for increasing funding for mental health center locations? Is the legislature going to go back into special session and make cuts to those now?
I'll start by saying that's still a priority for me. I don't, that's not a place that I want to make cuts.
And I agree with you, Sharon. I don't foresee that being somewhere that we would look to make cuts, because there's a recognition of the fact that we need to continue building on the additional services that we've worked hard to fund as a legislature over the last several years. And we also recognize too that one of the impacts of this pandemic is the fact that people are feeling anxious and fearful and uncertain about the future. And now more than ever, all of us need to make sure that there are those supports and mental health services available to get us all through this.
Absolutely.
Great. We have one last question, and this is not a COVID-19 related question. This comes from Michael in the chat. Michael wants to know, since you were talking about construction, what is the latest on the I-5 bridge replacement?
Michael, great question. Thank you for that. we are continuing to move forward in our work to replace the I-5 bridge. We had previously scheduled an April 21st another bi-state legislative action committee meeting with our Oregon colleagues. Unfortunately, given the crisis we're facing at the moment, we have postponed that meeting while we look into how to access the technology that we would need between the two states to hold a virtual meeting and ensure that we can include the public in that meeting. So we're working through those details now. And in the meantime, the co-chairs of the bi-state committee are meeting on April 21st virtually to plan our next steps forward. And so the work continues, and as you recall, we appropriated $35 million in the state of Washington in last year's budget to open a project office and to begin the pre-planning work that needs to be done. The work to open that project office continues, and the effort to hire staff for that office continues. So we're still very much on track in our work to replace the I-5 bridge.
Great.
Thank you, Annette.
Oh, sorry, go ahead. Go ahead, the representative.
I understand that was the last question, and we're coming to the point where we need to wrap up. I think we have enough time for us each to talk about something non-virus related from session that we want to share with the district, and then make a few remarks to wrap up. And then it'll be the end of our town hall. Hopefully the next one will be in person. And I guess I will start. One of the things that we talked a lot about the regular budget. What I did this last session was I was on the budget team that rewrote the biennial budget that we had done over a much longer session last year because of the initiative that passed that became the law of the land. We had to redo our entire transportation budget. And we still are going to be looking at the revenue projections. But what we were able to do was commit to providing transportation for our most vulnerable people, working to finish projects and maintenance that was already started, and putting a lot of other projects on pause until we could come back, figure out where we are with the virus, with our economy, and take the next steps. And that's going to mostly happen next session in January. Annette, Monica, would you like to make some closing remarks and share some other information? Hello?
Sure, I'll start. Okay.
Go ahead.
Thanks. So I'll start. I think a couple of the wins that we had this session that we'll continue to benefit from is some policy changes related to telehealth. And while it may not necessarily have been in anticipation of a pandemic, it certainly is serving us well in this time. And so I think being forward thinkers in Washington State about different ways to provide healthcare has been huge. In addition to that, our schools are continuing to look for ways and highlight the best practices in areas of inclusive practice so that kids with special needs in school and in their learning have an opportunity to experience more of what general education population students experience. And we're going to see some fruits of that good work here in Southwest Washington in the next couple of years. I would say in my very dear thanks to Dr. Melnick for joining us this evening, that the final parting message I would leave with folks is that we saw in the slides that Dr. Melnick shared with us earlier that our hospitals have not necessarily reached capacity, that there is room to serve patients, which means that we are doing the right thing. Without the physical distancing and taking into consideration the actions that we should be taking as individual community members, but also at the state level, put us in a position where we did not reach a peak that put our hospitals at capacity, which would have been detrimental not only for the lives of people that we love, but also a cost to the state. So I've been saying for the last week that we should stay the course and continue doing the good work that we're doing if you want to ensure that the hospital supplies and the healthcare supplies are available for those who are going to need them as we find our way out of this pandemic. So my thanks to Dr. Melnick, but also to those of you that are taking this pandemic and the regulations and suggestions from health experts seriously. Thank you.
Absolutely.
Great. And I know we're running short on time. I'll just briefly mention several of the bills that I prime sponsored and passed this year that I'm particularly pleased about is an in-home healthcare worker safety bill, an ambulance quality assurance fee bill that helps to increase reimbursements and therefore wages for our first responders, our paramedics who are hardworking. Also, a bill to better address those difficult to discharge patients that are stuck in hospitals, and happy to talk with anybody more about those bills offline if you're interested. What I want to say in conclusion is that, this pandemic response here in the state of Washington has honestly involved every elected official at all levels of government. I've been so appreciative of the spirit of collaboration from Governor Inslee and his strong leadership, to my two seatmates, to our Clark County Council, Chair Quiring, our Vancouver Mayor Ann McNerney Ogle, and our City Council. I mean, this has just been a tremendous team effort, and as always, led by our public health experts and Dr. Melnick. I just can't express to you enough my gratitude and thanks for your continued hard work. I know you've been putting in some very long hours, and it's really a testament to your work that we here in Clark County have really been able to flatten that curve and prevent needless deaths. Want to just finally share that, as an elected official, I'm continuing to work hard with my colleagues, with my seatmates, with our public health experts, our business community, our community leaders, to continue to meet this challenge head on. And know that what you've been doing, each one of you, has been working. Keep doing it. And as always, stay in touch with us. And thank you for joining us tonight.
Yeah, thank you to my seatmates and Dr. Melnick. Dr. Melnick, you really put the public in public health by sharing your expertise in so many places and being so available. Thank you so much. And I look forward to our next town hall where we can shake hands again. Good night.
Good night.